What about so when I think of primary dental, we're in a medical center home, right? And it's large. We have about 600 to 900 patients coming through our medical center each day. Integrated care is at our core. So it's all around the patient, and we know that. And we also know that, if we work together with our GPs or we work with our care plan nurses and things like that, is that we get the best patient outcomes. Do you think that, do you think that's why staff will join us and dentists join us? And do you think that collaboration that they have with that integrated care is just something unique to primary dental and the full health group?
I think it's for me particularly when I joined, I absolutely loved that our all of the practices were multidisciplinary. And when you're working in a private practice, a standalone practice, you do feel quite isolated in the world of health and overall health. And I think when you're joining somewhere that's multidisciplinary and you're now more exposed to all the disciplines and how they can work together and integrated care, it is really hard to go back. I mean, a lot of people that work in dental are very passionate about dental and they love being in dental. And normally, it's not uncommon for people who work in dental to work in dental lifelong because it's so satisfying. It's such a satisfying industry to be in. But it's just so nice to have those other disciplines at your fingertips and work in such a large establishment and organisation. I think that really motivates people and they get to see the whole picture when it comes to a patient's health.
It's really funny. We call it the water cooler conversations, where a dentist may be talking to a GP and they're just getting their glass of water, and they're talking about probably the footy, but they're also talking about patient care. I think we are uniquely placed. Sharath, what do you think when people are, finding out about primary dental? I mean, are they asking about the integrated care, and that's what they're attracted to?
It is a plus point because we're inside the medical center, patients don't know where to go. There are mostly emergency cases going to the GPs, and it's mostly dental related, and they get referred to the dentist. And they don't have to travel anywhere far. They just have to just walk to the next room, and here we are.
Yeah.
So it does help a lot of dentists, and it is attracting a lot of people.
Amazing, amazing. Great.